Jerusalem, the city of gold, rich in history, heritage and diversity, sacred home to Judaism, Christianity and Islam. Jerusalem is the poorest city in Israel, with many immigrants searching for ways to earn a living. Jerusalem's children are under constant pressure, political, economic and social. The city's children and adolescents have the highest rates of stress disorders of any major city in Israel. Current waiting times for social services at the municipal clinics are over 12 months. Hospital emergency rooms are simply not equipped to provide relief for deep-seated psychological trauma and stress. With 40% of Jerusalem's population being under the age of 14, there is a desperate need for a crisis intervention centre.
Hadassah really is there to look out at our community and say, how can we help? How can we bring calmness, treatment and prevention of future problems to the kids and their family at a time where they're lost under the radar screen?
We provide psychiatric services for children from infants to adolescents, 0 to 18, and actually a full spectrum of services from infant psychiatry, outpatient services, all the way through day treatment, and finally to inpatient 10 beds. The Crisis Intervention Center allows our staff to address these children immediately, to evaluate them and to implement the most appropriate intervention.
When Esti Galili was head of the Child and Adolescent Psychiatric Department of HMO, who was recently in Melbourne, hers is the department that we've adopted, a project to support children in Jerusalem who are suffering from post-traumatic stress disorder. And that resonated with our donors because it was Jerusalem, it was children, it was psychological stress. It really made it was something we could take ownership ourselves.
We have patients that are Jewish Orthodox, we have patients that are Jewish secular, we have Arab patients, we have new immigrants, Russians, Ethiopian, actually French and Americans. Most of our patients would not be able to get therapy if it would not be for our center. It's very, very important that mental health services, psychiatric services, psychological services for children are free of charge.
The increasing availability of psychiatrists, psychologists and social workers has made this a center where children can be referred to and they can come at their own leisure without any sense that they are ill.
They all know that this place is for them and it's easy accessible for them and it's there to help them to get better. And we're very proud of it.
If we can make a difference to the life of a child, it's not just changing the quality of life for the child, it's actually the benefit that flows to the parents and to the family.
Because every child has a right, like for education, for health and so on. So we actually totally depend on at this point for a large support from outside resources to keep our clinic going.
Without the support and ongoing significant support of our donor base, we won't get there. But with that support, I think over the next 4 or 5 years, we'll be able to look and feel and see that we have made a real difference to the life of the community of Jerusalem.
We couldn't do it without you. We are very proud to deliver help to the children that need it, and we're very proud to be partners in this with you together.